Hi guys, in today's video, we're going to go over some reasons why you would want to seek a comprehensive autism evaluation for your child and what's going to ensure that they get the help that they need when you go through an evaluation process. So I'm going to go over three different things. I'm going to go over why get a comprehensive evaluation versus just a screener or having the school district do it. I'm going to go over the different tools your clinician should use. And I've got a video on adults getting an autism diagnosis. There is going to be a lot of overlap between these, but there's going to be some very key differences between them. And three, what most clinics out there will do in order to see patients, like their process, and how we're a little bit different here. Hi, my name is Dr. James Thatcher. I'm a licensed clinical psychologist. I've been doing these evaluations since 2016, anywhere from 3 to 5 a week. So if you're doing the math, that's around 2,000 evaluations. So why get a comprehensive autism evaluation versus just a screener or having the school district do it? A comprehensive autism evaluation is going to give you a couple of different things. It's going to not just look at autism, but other issues that may be going on as well, such as ADHD, borderline personality disorder, trauma, mood issues, things of that nature. And it's going to be able to say, yes, it is autism, and there's these other issues going on as well. And particularly in like adolescents and teens, there typically is other things going on, like depression or anxiety or trauma, something like that. Or it's able to give you the answer of, no, it's not autism, it's this thing instead, and here's why. So what a screener will do, they won't be able to look at all these different issues. They're just going to ask you some basic questions about autism, and it really won't give you a whole lot of answers. And on top of that, it's not a medical diagnosis. That's the same issue when it comes to the school district. If your child's had some sort of testing done through the school district, typically it's an autism designation and not an autism diagnosis. So if you were to ever seek any sort of help or support through the government or community, they typically won't recognize that because it's not a medical diagnosis. You're going to need to go see a clinical psychologist that ideally has been doing a number of these evaluations so they can look at the nuances on what's going on and be able to write a really solid report for you in order to get your child or teen the support that they need. So the tools that we use, and I'm going to go over the tools that I use. I'll try to go over some tools that other people might use that is also going to be valid, especially if you're going to get them any different government or community resources. And I like to make this battery just for everyone, regardless if they tell me during the consult if they're going to seek services or not, because I want to make sure that maybe the patient changes their mind as things move on. Things come up. But I want this evaluation to help them for the rest of their life. So I'm going to set it up to where if they do need services in the future, they can use this report and go and get it. So here's the tools that I use. I'll do the initial consult with them, go over the process, talk about the tools, and we'll send some intake paperwork, like going over their family history, their contact information. There'll be a document going over clinic policies and procedures, things like that. It's pretty typical stuff. But then we start sending some online measures that they can do. We like to do it online to make things a little bit more efficient, but some folks may send it through the mail or may have you fill it out the day that you come in. The measure that I like to use for children, and I'm going to mainly talk about kids from 5 to about 18, because it's a little bit different for kids that are younger than that. So I'm going to use two different measures. One is called the ABAS. That stands for Adaptive Behavior Ability Scale, and we're on the 3rd edition. There's another one called the Vineland that looks at very similar things. I tend to use the ABAS, but the Vineland works just as well. And for kids, I typically have the parent fill that out. And what it looks at is adaptive behaviors. So social skills, communication abilities, self-care, self-direction, and it compares them against other same age children to see where they're at. And it helps determine level of functioning. It helps determine how impairing are these symptoms that's going on, be it autism or ADHD or BPD, borderline personality disorder, or trauma. It helps determine level of functioning. And the other measure that I send, it's called the BASC. That's a behavioral assessment. And that's going to be looking at a range of different issues like depression, anxiety, ADHD symptoms, inattention, hyperactivity, social withdrawal, things of that nature. And I'll have the parent fill it out, and also a teacher that knows the kid really well. So if that's a teacher that discounts a lot of things, or maybe they've just known the kid for a couple of weeks or a couple of months, that's no good. We got to use a teacher that knows the kid really well, and maybe that was a teacher from, last year. That works just fine, because what I'm looking for is another perspective. And the other thing that the BASC does that helps rule out, and I know I'm kind of really focusing on ADHD, but ADHD overlaps with autism about 25% of the time. So I really want to look at that to see if that happens. That's very significant. And in order to diagnose something like ADHD, it can't just happen in one setting. It's got to happen in multiple settings, because ADHD, it's a neurological disorder. So it would be happening in multiple settings and not just one or two, right? So I'll have the parent fill that out, a well-known teacher fill it out, and if it's an older teen, I'll send out a self-report. And that just gives me everybody's perspective on what's going on. And the more sources of data that I have, the better. Okay, so once those are filled out, this is the day of the appointment, when the person would actually be seen in person. So I'm going to do multiple different assessments that day. I'm going to do something called the ADOS, and that's the gold standard in being able to test for symptoms of autism. Basically, it's structured tasks, structured questions that pull for symptoms of autism, so I'd be able to see some of it that day. Another test that we'll use is called a cognitive test, otherwise known as an IQ test. Typically, it's going to be the Wechsler Intelligence Scale for children, but if it's for older teens, we can use the WAIS, Wechsler Adult Intelligence Scale. And there's also something called the Stanford Binet, which can be used across the lifetime. And all of those cognitive tests are very, very good. Again, I would use one of these in order to give support. And the other reason why I like to use a cognitive test is not only is this what government and community resources look for in order to give support, they want to make sure, basically they got to check off a box that says this person doesn't have intellectual disabilities. And an IQ test can prove that, right? And it helps rule that out in case that is an issue. Another reason why I like to use it is it looks for symptoms of ADHD. There's lots of really good subtests on there, like working memory and processing speed, that tend to load fairly highly on folks that have ADHD. That tends to be some sort of impairment going on there. So I want to look at that. Another test that I may use, especially for an older teen, is an MMPI. It's got a little bit of an overlap with the BASC that I talked about earlier, but it goes much more in depth and it's very evidence-based. In fact, all the tests I've talked about today are evidence-based, meaning they've been tested on thousands of people over a long period of time, and it develops what's called norms, right? What kind of falls in the average range, and then what kind of falls outside of that to where it could be clinically significant, or, hey, something is going on here. And MMPI, so not only does it look at a lot of the things that the BASC looks at, but it goes more in depth on issues of trauma, personality disorders, substance use issues. Again, I want to get a comprehensive picture on what's going on here. Another thing that we'll do that day is a full clinical interview. So going over all of your child's or your teen's medical history, background, any concerns that you may have. I'll ask the teen a lot of their concerns, any issues with depression, anxiety, trauma, things of that nature. And on top of that, I'll do something called the ADI, or Autism Diagnostic Interview, where I'll be asking a lot of questions about autism, and not just nowadays, but when they were younger. Because if they are on the autism spectrum, it's a neurological disorder. So it would have been going on since they were a kid, and you would have seen some things. And then after I'm able to do all of that, I can give feedback that same day. So this brings me on to my third point. So a lot of clinics out there and a lot of other clinicians out there will spread testing out multiple days. And there's positives and negatives to that. Positives may be that maybe you get drained really easily and you just need it done in chunks. That's totally fine. And I'm amenable to that as well. But from my experience, what I have found is, yes, this can be a lot of testing in all of one day, but I try to keep it as light and as fun as I can, especially with teens, but with adults as well. And the big thing is you get results that day. You get to know the answers that day. You don't have to wait weeks or months and then later on get feedback sessions several months down the road. You know that day. After all that work, there's a payoff. So that's how I like to run evaluations. I get it all done in one day, and I can write up the report within a week. Because I've been doing this for such a long time, I'm a really fast and efficient writer, and I get it in within a week, and I'm very open to where if patients have any questions or concerns, they can come back. They can ask me questions, reach out at any point in time. And your clinician should be doing that as well. So guys, if you really liked this video, please hit like or subscribe. It really helps that math monster known as the YouTube algorithm. Send these videos out to other like-minded people or people that may be looking into an autism diagnosis and what the steps are to look for. If you like this video, like I've kind of mentioned before, I have another video on the process of getting an adult diagnosis. There is a lot of overlap, but there are some key differences to look for. All right, hopefully I'll see you there. Bye-bye.